Hi, my name is Chelsea Okundalor, and today I'm going to be talking about the community-based organization Peer Health Exchange. Peer Health Exchange aims to target low-income adolescent and teens in high school. The problems they address is to bridge the gap in underserved communities with unmet health education needs. They believe in a world where every young person has full access and every opportunity to a healthy, happy life. To make this a reality, they commit to a pro-libertarian approach while working alongside the young people they serve to dismantle unequal power struggles that hurt us all, but especially those with marginalized identities. Now we're going to be going over Healthy People 2020, their goals and objectives, and how Peer Health Exchange achieves those. For education and community-based organizations, the goals are to increase the quality, availability, and effectiveness of educational and community-based programs designed to prevent disease and injury, improve health, and enhance quality of life. An overview of the objective states that health status and related health behaviors are determined by influence at multiple levels: personal, organizational, institutional, environmental, and policy. Because significant dynamic interrelationships exist among these different levels of health determinants, educational community-based programs are most likely to succeed in improving health and wellness when they address influences at all levels in a variety of environments and settings. Specific objectives that they need to meet: increase the proportion of elementary, middle, and senior high schools that provide comprehensive school health education to prevent health problems in the following areas: unintentional injury, violence, suicide, tobacco use and addiction, alcohol and other drug use, unintended pregnancy, HIV, AIDS, and STD infection, unhealthy dietary patterns, and inadequate physical activity. How PHE or Peer Health Exchange meets specific objectives. The Peer Health Exchange curriculum is designed to give teenagers the knowledge and skills they need to make healthy decisions. Through their skill-based curriculum, they aim to reduce unplanned pregnancy and substance abuse and increase health-seeking behavior. The curriculum aligns with national health and education standards. Peer Health Exchange's curriculum is currently relevant, age-appropriate, and medically accurate. Now we're going to be talking about Peer Health Exchange's organization. They're a 501c tax-exempt community-based organization. Their mission statement is to empower young people with the knowledge, skills, and resources to make healthy decisions. They do this by training college students to teach a skill-based health curriculum in under-resourced high schools across the country. Their vision is to, with their partners, advance health equity and improve health outcomes for young people. The program works by partnering with high schools that share their belief that health education is fundamental to a young person's success. The volunteers follow a near-peer model, and they are selectively recruited and rigorously trained college student volunteers to be health educators in the classroom. As slightly older peers, Peer Health Exchange's health educators are well positioned to lead honest conversations about high school students' choices in health. Volunteers teach 14 workshop curriculum in which students develop skills in decision-making, communication, and advocacy. Community partners. Peer Health Exchange links students from classrooms to clinics to help young people get the resources they need. Through in-person or virtual tours, Peer Health Exchange introduces students to health centers and staff and services. Marketing. They market through many publications they have been featured in, through word of mouth from volunteers and participators, through flyers and posters distributed online and in person. Their strengths and weaknesses. Strengths include educating adolescents and teenagers and young adults, providing resources for individuals who may need further aid from medical professionals, and their weaknesses depend on the volunteers and how well they're able to train them. If they lack information, that could also be a weakness in the program. The inability to reach all individuals who may need this type of health education is also a weakness. Their goals and priorities. As I mentioned before, they educate many college students who then educate many more high school students. In 2016, they were awarded the Society of Public Health Education Program Excellence Award. And from 2016 to 2021, they created a strategic plan that has three major priorities. Those priorities include delivering and growing their stronger PhD program, partnering to build a more integrated model for health education, and building capacity to fuel and sustain impact. Impact on the community. PHE recently invested in an external evaluation conducted by the American Institutes for Research to learn what works and what doesn't work. The study included 4,000 students comparing those who received PHE and those who did not. The PhD students were more likely to A, visit a health center, B, know how to access contraceptives and show greater intentions to use them in the future, C, accurately define what constitutes consent in a sexual situation, and D, identify the warning signs of poor mental health. Here's a graph distributing what I just said. As you can see, the PhD students had higher percentages in all of the above categories. Now we'll go over youth behavior statistics. 3 in 10 teenagers is sexually active, and of those teens, 57 did not use a condom the last time they had sex. 1 in 10 teenagers experienced violence in a relationship. 21% of teenagers use marijuana, and 18% of teenagers binge drink. 3 in 10 teenagers report feeling consistently sad and hopeless. 18% of teenagers had seriously considered suicide. This is why health education is so important. These preventable health concerns contribute to the staggering reality that over 1 million students drop out of high school each year. Health education improves young people's health outcomes, high school graduation rates, and life opportunities. They're culturally competent because they have a diverse board of directors as well as a diverse group of volunteers, which I'll show you in a moment. They provide meals for individuals who may need it without asking questions, and they offer their programs in more than one language. They use graphics on their flyers and a website to make it easier. Leadership and key contacts include their CEO, Louise Langhire, their head of sites, LaDawn Best, their 2 vice presidents, one for marketing and communication, Adriana Diaz, and one for programs and strategic learning, Dr. Angela Glimpf. And that concludes my presentation on Peer Health Exchange. You can visit their website. I'll link it down below, but it's also on the screen. I hope you enjoyed this presentation, and I hope you learned something. Thank you.